Come in.
Dr. Brunson, you wanted to see me?
Nurse Rufus, I have a patient that is 57 years old. She's a Caucasian female. She was diagnosed with diabetes in 2009. She came to the emergency room with left foot pain. She reported that she doesn't know how the wound got there. She just knows that her foot's been hurting for weeks. The wound started off as a cut. Now it turned into a boil. Now it's an ulcer. She just went to surgery for debridement, and she previously had an amputation of her second toe on her right foot. So she's currently on the medical surgical unit for dressing changes to her left foot and diabetic foot teaching. That's where you come in.
Okay.
I need you to help her with diabetic foot care.
Okay, very well.
Thank you.
Thank you.
Come in.
Hello, Miss Amanda. How are you doing today?
I'm good. How are you?
I'm doing real good. Well, my name is Rufus, and I'm going to be your nurse today, all right? Well, today we're going to go over diabetic foot care.
Okay.
Now-
Nobody ever taught me about diabetic foot care.
Really? Well, it says right here that you've had diabetes for a year. That's strange. Well, today we're going to go over that, and you'll be all good to go, all right?
Okay.
All right, first of all, I want to show you how to wash your feet,
Okay.
all right? Because diabetic foot care, you have to wash your feet. Now, what you want to do is get some warm water and make sure you have a bath thermometer, okay? Can you say bath thermometer?
Yeah, the bath thermometer.
Good. So, you want to take the bath thermometer and measure the temperature of the water and make sure it's not too hot so you won't burn your feet.
Okay.
All right? So you take the soap, take the cloth, squeeze it out, and start washing your feet.
Okay. You use that with warm water, right?
Yep. Get in
Okay.
between your toes, on your heels, and then get all the soap off,
Okay.
dry it up, okay? And then, this is the special part, all right? You use a mirror and you inspect it. This is very, very key.
Okay.
You want to make sure you don't have any cuts. And what do you
Right.
do when you have cuts? You call your healthcare provider,
Okay.
all right?
Anytime I
And then
see a
you,
cut.
yes, and then
Okay.
you schedule an appointment so that the doctor can check your foot,
All right.
all right? Because you don't want a foot ulcer.
Yeah, because this foot over here, it hurts so bad.
Really?
Yes. It started off as, just like this little, it grew so fast I couldn't even pay attention. It's like it started off as this little cut, and now it's all over.
Well, another thing is socks and footwear. I could tell you've been wearing these everywhere.
Yeah, I tend to wear them outside. I like to walk around barefoot, and, I like to wear my socks outside, and,
Please don't do that, Amanda. Because I don't want to see you in here again, all right?
Okay. So, what kind of socks should I wear?
Here are some beautiful, clean socks.
Okay. I like those socks.
These are some clean socks, all right?
Mm-hmm.
And these are the type of socks you want to use. You want to make sure your socks are clean so that you won't introduce any extra bacteria onto your cuts or onto your feet and cause skin breakage and skin breakdown. You don't want
Okay.
that. And then after you dry your foot and you inspect it,
Okay.
all right,
Mm-hmm.
you put some lotion on.
All right.
All right? And you don't want to get in between your toes.
All right.
You know
Not
why?
between the toes. Mm-mm.
Because it could cause skin breakdown. and it's a good environment for bacteria to grow.
And that will cause
Skin breakdown
okay. All right.
and another infection.
All right. So no lotion between the toes.
And that's why you lost the toe on this foot.
Yeah, I know.
Yes.
I know.
You need to
'Cause
start
I
taking care of
regretted
yourself. Yeah.
Because I've already, I only have 9 left, and I want to keep the 9 that I do have.
Yes.
So I want to listen to, I enjoy your teaching.
Good. Oh boy.
Oh, you like them?
They look nice, but it's probably why you're in here too.
And those are my favorite pair of shoes. I
Well-
wear them every weekend.
Well, you need to wear better shoes. You can't have open-toed shoes,
Oh, no.
and you cannot have high-heeled shoes.
Okay.
Okay?
All right.
The type of shoes that you want to wear are sneakers. All right?
Mm-hmm.
You want to make sure that you have a 1/2 inch to 5/8 of an inch
Okay.
room between your big toe and the end of the shoe. All right?
Okay.
Because you don't want to constrict your feet, and you don't want, because those shoes will constrict your feet, and you don't want that.
Yeah, and they tend to hurt more when I wear them.
Exactly,
Okay.
exactly.
All right.
So, we've gone over your socks.
Mm-hmm. So I guess you can throw those in the trash
No,
for me.
no. Yes.
Okay.
I've given you some new socks.
Mhm.
Here is your mirror.
Thank you.
Okay. After you after you wash your feet, you want to file your nails.
Okay.
All right. Make sure you file the
Yeah, because they're horrible
Yes.
right now.
yes. So you want to file your nails. You want to use an emery board to do so,
Okay.
and then you want to schedule every time you go to the doctor. You want to make sure that he shows you and goes over the proper ways to wash your feet,
Okay.
and then he checks it too. Okay?
So every time, even if I go for like a cold.
Yes.
Okay.
Okay?
Alright.
And that is very important. All right?
Mm-hmm. Okay.
What do you have here?
Oh, these are donuts. You want one?
Well, I'm going to have to confiscate this,
Why?
Miss Amanda. Because you're a diabetic. You got to watch your diet.
But they're good.
They might be good, but that's why you're in here.
Yeah.
And
I
that
guess
is something.
You're right.
That is what we're going to go over next week.
All right.
One little step at a time.
All right. Thank you, Mr. Rufus.
Oh, anytime.
I enjoyed
These
it.
are.
Come in.
Hey, Miss Amanda.
Hey, Dr. J.
I see that your feet have healed.
Yes.
It's time for you to go home.
I'm ready.
I've read in my progress notes that Nurse Rufus came and talked to you about diabetic foot care.
Mm-hmm.
Tell me what you learned.
Well, Dr. J, I'm going to start off by telling you I have brand new shoes now.
Good.
That are appropriate and they were fitted properly.
Good.
I also have the new socks on. They're cotton socks and breathable.
Okay.
And Nurse Rufus was so kind when he came in, and he gave them to me. He also gave me a mirror to inspect my feet daily, to inspect for any lesions, any cuts, because, before I used to walk around barefoot all the time. And he explained to me, that I can't do that anymore.
You can't.
Right, because I'm a diabetic and, the ulcers on my foot, they'll just get worse. So he explained that to me, and he also gave me, this nice list of things that I asked him to, so that way I can remember when I go home.
Okay.
Such as don't soak your feet. And when if I do, want to get in the water, I need to use a bath thermometer,
Okay.
so that way I don't burn my feet.
Right.
And he also, he explained about my socks and my shoes, and he also told me I need to get rid of my dancing shoes. My pretty shoes. I'm not
Those
sure if you
shoes
saw them.
you came in with?
Yes. He told me that he had to confiscate them, and I let him because I don't need them anymore. I have the
Okay.
proper ones now. And he also taught me how to trim my nails across because I wasn't trimming them properly. I was just clipping here and there, and but I think I'm ready now. I have all the information I need, and Nurse Rufus was really good to me, and he taught me a lot.
So what are you supposed to do the next time you go to the doctor?
The next time I go to the doctor, always get my feet inspected.
Good job. I think
Yes.
you're ready.
Thank you.
Good luck
Dr.
to
Jane.
you.
Thank you.
Bye-bye.